Right. All right. Hi, everyone. Thank you for joining. This is our first learning lunch. Topic today is going to be about the NeoGen, which is one of my favorite offerings here at Renew MedSpa. I have a little PowerPoint to share with you, so it shouldn't take too long. I'm happy to answer any questions that come up. Just put them in the chat on the side, and I will get to them. Let me just share my screen here. Give me 1 second. Okay, it won't let me minimize. Let's see. This is my first time doing this, so let's see. Keep top left. Let's see. Enter minimal view. Okay, look out. All right. Let's see. Share. Okay. Share screen. Share. There we go. Oh, make this bigger into a slideshow. There we go. Okay, so NeoGen. What is NeoGen? So NeoGen is basically a non-invasive procedure. It takes nitrogen plasma gas and it converts it to energy in the form of heat, so thermal energy. It delivers it to the skin in what feels and sounds like a pulsed laser, but it actually is not a laser. The dermal layer of your skin absorbs that heat and becomes damaged by it. And it results in your body actually coming in to repair that damage by laying down more fibrin, more elastin, more collagen. And those are the things that make our skin tight and lifted and healthy looking and young looking. Who does it treat? Honestly, it treats everybody. We just have to know how to treat everybody and manage the settings, but it's all skin types, all skin colors, men and women. Our target audience is typically between 30 and 70. That's most of the people that we see that could use this type of treatment. The one caveat is because it relies on your own body's repair system, the best results are seen on people who are healthy. They don't have chronic disease. They are adequate with nutrition and collagen supporting amino acids. So we tell everybody to take a collagen powder that has all the 19 amino acids your body needs to produce collagen for the best results. Non-smokers and people who take good care of their skin, because essentially you're causing this dermal injury, your body is going in repairing it, and then your results depend on the repair process. And those results last as long as the normal aging process, because that's your tissue. If you're not somebody who wears sunblock, somebody who goes tanning or smokes and doesn't use good skincare, doesn't take care of themselves, the results are gonna last a lot less long than somebody who does take care of their skin in their body. What does it treat? So the primary thing, the reason we got this device is because it's one of the best on the market for treating skin laxity. So skin laxity is sagging, essentially. That's due to aging, the loss of the fat pads in the skin. Weight loss, we see a lot of people who are on medically managed weight loss that develop a lot of like sagging, especially in the lower face, because they lose that fat in the face. We can use it to treat sunspots. We can use it to treat scarring, including acne scarring, skin lesions, rosacea, stretch marks. The thing that I love it for is the drooping eyelids, because I have really heavy droopy eyelids. And it is pretty much the only treatment on the market that is safe to use on the upper and the lower eyelids. It's pretty incredible what it can do to the eyes. I have a before and after that you will see later on of my eyes, but I do it every 6 months, and it's been a game changer for me. Is this a facial treatment? It is not only for the face. We can treat the abdomen. This was a woman who had a 30-pound weight loss, and she had a lot of skin laxity around her umbilicus. And this is after just one treatment. I haven't gotten the second treatment photos yet because she's not 90 days out from that. So she'll have an even better result than what you see here. But we've treated patients' knees, their necks, their arms, their chest, hands, abdomen, legs. It's really safe to use almost anywhere. I know there are indications apparently that you can use it for vaginal atrophy too. We don't do that here, but you can use it in lots of places. So there's two methods that we can use this device. There's the traditional method, which I'll talk about now, and then there is a NeoLift method is what it's called. So the traditional method, we will have you come in, we put numbing medication on, we leave it on for about 30 minutes, then we wash it off, wash the face, and then we treat the skin. The heat is absorbed in the dermal layer of skin, but it also affects the epidermis, or the outer layer of skin. So, and that's where the melanin and the pigment lives and the scarring. And so, you know, it helps with all of those conditions that are more superficial. It is a little spicy. It's hot. It's hot, even with the numbing medication. We do apply a calming gel immediately afterwards, which helps. And then we have the patient apply medical grade healing ointment for 48 to 72 hours. But you can expect a downtime of 7 to 10 days. Your skin will be very red, very splotchy. Then it kind of fades into this leopard looking appearance that can last 7 to 10 days. So it does have a little downtime. You know, the only discomfort is during the procedure itself. You don't ever have pain after the fact. It's just looks wise, you know, your skin, the color looks a little funny. Then it all fluffs off and it looks beautiful. But we make sure people know that there is some downtime with this method. This is me after I had just one. This was back when we first started doing NeoGen. I was doing a little guinea pig on myself, but you can see, you know, my upper eyelids just after one treatment are retracted. They look a little more open. My circles under my eyes are a little bit better. But my pigmentation, because I use the traditional method here, if you look at my cheeks in the picture on the left and even my forehead compared to the one on the right, all that sunspots from years of high school tanning beds lifted up, you know, not completely, but it was quite a bit better. So the other method, this is definitely a more popular method because there's really no downtime with it. It's called NeoLift. We do not apply numbing cream. We put a barrier gel on the skin. And then when we leave that gel on during treatment, and it basically prevents the epidermis from absorbing that energy. So it's the dermal layer down where the collagen, the fibrin, and the elastin live that absorb that energy. So this treatment results in lifting, tightening, and treatment of fine lines and wrinkles. It does nothing for the hyperpigmentation or the scarring. So this procedure is pretty quick. It takes about 30 minutes. It's really not painful at all. If you do feel some heat, that means we need to add more gel. So you just tell us, ooh, that was a little hot. We add a little more gel, and then it's nothing after that. After that, we do send you home with some biogel that just kind of is a barrier ointment on your skin. We have you apply that for 48 hours. And then after 48 hours, you can wash your face. So the only social downtime with this method is the fact that your face is like a little greasy and you can't wear makeup for 48 hours. We also don't want you working out heavily, going in the sun or the sauna. But your skin is a little blotchy, nothing terrible. It seems to be a little blotchier on the neck than on the face. But people feel totally comfortable leaving here and going to the grocery store afterwards. So the NeoLift, this is just an example of my face. This is how red I looked afterwards, just one day after. It's like barely noticeable, really. So like I said, there's really no downtime because of the synergy gel that we use. I'm not sure if I mentioned, but you do see maximum results with the lifting and the tightening over the course of 90 days. That's typically how long it takes. Some people it's shorter, some people it's a little longer, but it averages around 90 days where you'll see the best result with the lifting and the tightening. These are my eyes after getting it done the first time. Like I said, it's one of the only things you can use on the eyelids. So if you look at both my upper lid and my lower lid, the lower lid is kind of smoother, which makes the dark circles less apparent. And the upper lid is just lifted up a little bit. So that was a selling point for us for sure when we were demoing this procedure. How long does it last? Well, like I said earlier, it depends on you and how healthy you are and how you take care of your skin and your genetics too. My dad actually had such bad upper eyelids. He had a blepharoplasty that was covered fully by insurance. So I have his genetics, his eyelids, unfortunately. But I am doing my best to ward that off. That being said, I do my eyes every 6 months, and I feel that it works really well. In my face, I do just once a year. But everyone's different. And like I said, your expectations are a little different, so that might change the frequency, but also the aging process for everyone is a little different. So here are just some before and afters. This one right here, I'm not sure if it's your left or right, but for me, it's the left, is a before and after of one of our clients. The one on the right is actually a famous, she's a talk show host in the UK, and she did like an expose on this device because it started in the UK. And I read the article and I just copied the picture just to show what improvement she got after her 2 treatments. But the February 2022 is before, and the January 2023 is obviously, a year after being treated. And she just continued to improve over that course of time. This is the same client as before. If you notice, the lines around the eyes are improved. She is a big, she likes the sun a lot. She has a lot of sunspots, but she didn't want to do the traditional method. So we did the NeoLift for her. So you're not going to see a whole lot of change with her hyperpigmentation because we didn't target that during this treatment. She really was more concerned about the lifting and the tightening. This is another client, similar, she didn't really need to treat hyperpigmentation or scarring. So we just did the NeoLift method for her as well. And she was really happy with the results, especially like around her eye area. She really felt like the under eye area improved quite a bit, and her jawline was much tighter after having the treatment done. A couple more clients. This client actually only had 1 treatment. We usually recommend a series. So for best results, we recommend you get it done for 2 treatments, 60 days apart for the first time. She actually didn't want to do that, and she was traveling, and so we only did 1 treatment on her, but she had a really great result even with 1 treatment. on her eye area, her jawline, and even her skin tone and texture too. We did the traditional method for her. So, how to reach us. This is how you reach us. You guys probably all know how to reach us, but just in case you don't, this is what you can do to reach out to us. We are offering $500 off a package of 2 or $250 off a package of, well, a single treatment for anybody logging into this right now. I have not been able to see if there's been any comments at all. So let me kind of get out of here and go back to the Zoom and see if anybody has anything to ask. And I know you guys can see me, but I can't see you because I tried this earlier. Is it? Hold on a sec. Get out of here. I think I'm probably still screen sharing right now too, aren't I?
We don't have the screen share anymore, so we just see your beautiful face.
Oh, good, good. So I can't see any of you guys, but let me try and get back to that so I can see. Well, if you have any questions you want to ask me without the chat, feel free. Happy to answer whatever may have come up.
Yes, there is a question on chat.
There is. Okay, hold on. I can't seem to get out of my browser to get back to the little Zoom thing. Oh, wait, I think okay, I'm back. Okay, get that away. Okay. When does the $500 deal end? We don't have an exact endpoint for it, but it's a special promo that we're doing right now for anybody who's in this this little seminar learning lunch. I think we can probably work with you if you want to schedule something, but it's not like you have to call in right now and pay for a treatment. Any other questions?
No.
No. No. Okay. All right. Well, guys, thank you guys for logging in and hope you got some information they didn't know before. Happy to answer any other questions if they end up coming up. You can email us at renewyoumedspama@gmail.com. Call us, text us, or come in and visit us. But hope you all enjoy the rest of your lunch. Bye, guys.
All right, bye.